Hi. Hi, my name is James Sellers, and I am talking about the meeting for the Kansas State Board of Education nursing meeting that talked about policy, advocacy, and leadership from March of 2025. The meeting was pretty formal. It was in a boardroom. There was lots of board members, big table, and then, of course, people Zooming in or WebExing in, joining through a virtual setting. So most of the board members, of course, also had some sort of computer access to help with that. Participants included, of course, the nursing board representatives, some legal advisors, and public stakeholders, people, like nurses or people from the community that have something to say and have their input. The tone of the meeting was overall pretty professional and transparent. They talked about accountability and regulatory oversight. The meetings seemed to be pretty regular in efforts to evaluate nursing policies, licensure, disciplinary actions, and they provide a public forum where decisions can be talked about and how they impact the nursing profession, and they're discussed openly, ensuring that voices from both leaders and the community are heard. During this meeting in March, a couple of the key issues that they discussed were licensure and credentialing updates and nursing education and workforce development. The first discussion on disciplinary actions and licensure reviews is where the board would evaluate multiple cases involving nurse misconduct or compliance issues. This ensures that, of course, they have integrity and safety for nursing practice here in Kansas. And then the second discussion, of course, was nursing program approvals and curriculum reviews. They were addressing education standards and the alignment of program outcomes with the state and national expectations. These discussions are, of course, crucial because they pretty much directly impact how new nurses are prepared for practice, and this helps ensure public safety and, of course, high quality care that we can deliver as nurses. The impact of professional organizations and nurse leaders. It's pretty cool to sit there and see how professional organizations and nurse leaders can help play a direct role in influencing health policy. The Board of Nursing is a regulatory body, of course, and it collaborates with nurse leaders who bring expertise, insight, and, of course, their real-world experiences to the table. They're able to advocate, and that helps ensure that policies are not just bureaucratic, but, actually grounded in something that's actual and has patient care attached to it. For instance, nurse leaders can help influence curriculum decisions and licensure policies that they talked about, and that helps push for fair and ethical disciplinary procedures as well. This kind of leadership helps ensure that nursing policies reflect clinical needs and protect vulnerable populations, including both patients and, of course, the nursing workforce. One of the key takeaways from watching this board meeting was just how complex and interconnected policy and practice are. The decisions, really interact with each other. Decisions on licensure and education and discipline, they're not made lightly. There's a lot of talk and a lot of people that have input on them. They involve a lot of in-depth discussions. They have legal counsel and, of course, the general public and those that it really affects are stakeholders. I also can see the importance of needing all nurses at all levels to understand that we work in a regulated environment, and of course it's not enough just to be good at what we do, but we also have to be aware of what we're doing and the laws and guidelines that help shape our profession. For application for future practice, I'm currently in the MSN program. I'm a charge nurse, work bedside. I do all the things frequently, but it's interesting how you can clearly see and step into a leadership role in shaping health policy, whether it's just serving on committees or contributing to like health curriculum development or participating in professional governance. You can use your knowledge to help build a safer and more accountable healthcare system, and understanding how policy impacts everything from just nurse education to patient safety, and knowing some of that stuff helps give you tools to advocate effectively for change. Ultimately, this knowledge can help strengthen anybody's leadership and empowers me and can empower others to elevate both patient safety outcomes and team member morale. In conclusion, it's nice to sit there and reflect and think about how vital everything is, and the transparency and the collaboration between nursing and leadership and legal counsel and the board members, and seeing the process behind licensure decisions and program approvals happen. It really shows that policies really do have people advocating for this stuff, and it's really shaped by a lot of people. I think a lot of people don't realize that anybody can go in and do that, and it's sometimes people out in the trenches think that it's people that are far removed making decisions all the time, but that's not always necessarily the case. So I think it's important to remind everybody that, everyone does have a voice and can help advocate for those changes, but it's also important to remember to know policy and follow policy when it's appropriate and all that stuff, and make sure everything is safe and ethical and equitable. So it's important to remember that everyone's voice matters, especially when it comes for advocacy for both patients and our team members. And here's the reference and YouTube video recording for the March 2025 Kansas Board of Nursing meeting.